गुड इवनिंग डॉक्टर्स। जैसा मैंने आपको कल अपने वीडियो में बताया था कि मैं आपको किस तरह से हेल्प कर सकता हूं, क्योंकि काफ़ी बच्चों की क्वेरी आई थी और कई बच्चे डिसअपॉइंटेड भी थे कि हमारे जो क्वेश्चंस थे इतने रिकॉल पे आने के बाद में भी मैनेजमेंट डॉक्टर्स नंबर कम है, या जैसा मैंने आपको इसमें अपने वीडियो में बताया था जितने भी इश्यूज़ हैं वो सही ढंग से आ नहीं रहे थे। तो मैंने ये सोचा कि क्यों ना आपको मदद करने के लिए कि आपको इसमें आगे के एग्ज़ाम में काफ़ी हेल्प मिलेगी, और ये जो आपकी प्रिपरेशन है उसमें भी हेल्प करेगा। तो नवंबर में एग्ज़ाम है INI CET का, और नवंबर में ये चूँकि मैंने ये सोचा कि मुझे भी बाहर जाना है अपने कॉन्फ्रेंस में पेपर प्रेजेंटेशन के लिए, तो उससे पहले मेरी कोशिश रहेगी कि मैं कुछ जो इम्पोर्टेंट टॉपिक्स हैं जिस पे आपके कम से कम 60-70% क्वेश्चंस जो हैं वो कवर हो जाएंगे। इसके अलावा आपको कीवर्ड्स पहचानने में दिक्कत नहीं आएगी, और इंटीग्रेशन जो है वो क्वेश्चंस का किस तरह से होता है वो भी आपको समझ में आ जाएगा। हालांकि आप लोगों को ये चीज़ें पता होगी, आपने इतने पेपर दिए हुए हैं, बट एक चीज़ आपको मैं ये बताऊं कि you all are adults, and in the adult learning principles are entirely different from the kids learning. Why? Because adults have the knowledge, adults have some preoccupancy in the mind. Meanwhile, on the other hand, kids have the fresh mind. They don't have any preoccupation, so whatever you want to teach to the kids, they will learn. But to teach to the adult is a different task. So they will pose a question, they will have some preoccupied things, and the way they see the things is entirely different. So and different for different persons. So that affects your performance in the examination. So that is our strategy, because we as an working as an organization, we are imparting training to the professors of the medical colleges, different medical colleges. We are also providing training to different frontline workers, so to the administrators. And this is our norm, that when we are doing the training, we are just examining their knowledge about the subject by the through pre-test. We are not sharing any result of pre-test with them, because that's sometimes embarrassing from the administrators, because in many cases we have noticed that professors scored less than our pass criteria, that is 80%. So that's why just examining during the course of next theory related to that topic, we are covering all those aspects, so that person will realize, okay, I was wrong on that questions, and his or her performance improved in the post test. So keeping in this mind, as I mentioned yesterday, that I'll take some important topics. So first topic, which is very important, and you have seen the many questions, 5-6 questions of from this topic, integrated questions of different subjects. That's the inflammation and the wound healing. So that's a very important topic. So I'm sharing pre-test questions with you today, 25 questions. And what you do is you just go through these questions, answer these questions, and then tomorrow I will discuss the theory part. That's a very important topic. If any doubt remains on these 25 questions, you can pose in my comment box, so that we will discuss it after the theory tomorrow, when I'll share the theory with you. And then tomorrow I will discuss the theory part. And if any doubt, that's the 25 questions thing with you. And now we will discuss it after. So just to share with you these questions, share the theory with you. And then tomorrow, yeah. So I think it is visible to all of you. So just what I'll do is I'm sharing these questions on screen right now, and on the description box after the video I will share a link from where you can download these questions and you can attempt these questions.
To all of you,
You can go through these questions and these will help you in your study.
I am sharing these
And
questions.
mind it, I am not going through with the entire syllabi, but most important topics which are integrated across the various subjects. Like this topic is you study with the pathology, but it's very important. It crosses some question integrated in pharmacology, some question integrated to medicine, some integrated to surgery. So different aspects associated with it.
Which are integrated.
The question number 1:
various subjects like
which of the following is not a feature of inflammation? So
study with the pathology, but
you have to identify the what is the keyword. So for your convenience, I have highlighted the not in a bold capsule. So you have to give the answer. You give the answer afterwards, not along with the
which of the following is not a
video.
feature of inflammation?
Which of the following graph depicted
Identify the
Starling law inflammation correctly? Starling law for inflammation correctly. So there are 3 graphs. You have to identify which is correct for the inflammation.
Give the answer afterwards, not along with the which of the following is not
Question number 3: which of the following cell is not involved in the chemical
Starling law
release, that's the histamine, in particular, in immediate response to the inflammation?
You have to identify which is
So,
correct for the inflammation. Give the
Involved in chemical release, they may ask, they will not give you the name of the
Question number
chemical,
3, which of the
but for
following
your convenience,
cell is
this is the
not
first
involved
test, so
in the
I have given the name
chemical
histamine over here.
That's the
But this
histamine.
question may be
in particular
changed.
in immediate
Inflammatory
response to
mediator
inflammation.
nitric oxide released from.
So correct for the
So during inflammation,
Involved
as
in
you all know,
chemical
nitric
release, they
oxide
may
released
ask,
from
they will
where?
not give you the name of the chemical. Which of the but for your
Which of the
convenience,
following
this is the first
activities
test, so I have
in
given the name
phagocytosis
histamine over here.
not involving
But this question may
endothelium?
be in particular
So
changed.
this is out of 4. There is a one activity which is not involving endothelium.
So during inflammation, as you all know, nitric oxide released
Then
from where?
which of the following ion is involved in the
Which of the
neutrophil
following
migration in inflammation?
Phagocytosis.
Then I have given 3 statements during phagocytosis. These all 3 activity happen during phagocytosis or not. You have to identify the correct response. Which of the following is a not an oxygen dependent microbial killing mechanism? So you have to identify this which is not an oxygen dependent, independent to the oxygen.
During phagocytosis, these all 3 activities.
Which of the following is incorrect for the acute response of inflammation? Now this is a image-based question. This question may come with a clinical history or some clinical finding, but my purpose to giving this directly this question is you have to identify the tissue by the color, by the appearance, so that you can easily identify in the exams and you will not get confused with the history in the examination.
This question may come with a clinical history.
A 15-year-old male
finding. You have to identify.
15-year-old male
is directly this question is you have to identify the tissue
comes to
by
you
the color,
with a complaining of
so that you can
stabbing in
easily
chest,
identify in the
stabbing
exam.
chest pain,
You will not
shortness
get
of breath,
confused with the history
and low
of
grade
this
fever
examination.
and no other significant finding on
A
examination.
15-year-old
This child have received the 2 doses of COVID-19 vaccines recently. His other immunization status is also up to date. He has no family history of cardiac disease and not to respond, not reported any such illness in past, and he is giving the history of habitual eating of spicy junk food often. What is your diagnosis? So you have to identify the diagnosis. When you will get the keywords, then definitely you will get into this. Which of the following is incorrect? So there are 5 points are given in this graph A, B, C, D, E. So you have to identify which is not correctly combined. Again, this is an image-based question. You have to identify the type of wound. So in examination, these questions may come with a history and they may give some dependence organ or some scratching or some whatever history is there. But my purpose to give this image over here that you have to identify that the wound type. So you have to identify the wound. Now I think seeing this picture, something comes in your mind because you have seen recently this picture, and my purpose to give this image over here, answer, you have to identify what is your answer in this question. The language of this question, I know the original language of this question I did mention over here, but if I mentioned over here, then definitely because you have seen recently, you will more relate to the recently where you saw this question. But I want to see that what is your answer in these questions and what answer you have given in recent time for this question. A 25-year-old patient from a rural area comes to you at CSC with a sloughy wound for dressing. What should be characteristic of this patient's dressing? This is again an image-based question. So type of dressing is given in this image. So you have to identify the dressing and then give the answer of this question. A 53-year-old woman has had high fever and cough productive of yellowish sputum for the past 2 days. Her vital signs include temperatures raised mildly, pulse, respiration, blood pressure given on auscultation, chest crackles are audible in both lung base. Chest radiograph show bilateral patchy pulmonary infiltrate. Microscopic appearance of her lung shown in the figure. Which of the following inflammatory cell type is most likely to be seen greatly increase in number in her sputum specimen? So, microscopic appearance of lung is given, and they are asking what will be the microscopic appearance of the sputum. Which of the following inflammatory cell type is most likely to be now another question is increase in number in her sputum specimen. A 4-year-old girl has had recurrent infections with Staph aureus since infancy. Genetic testing show a defect leading to lack of beta-2 integrin productions. Which of the following abnormality of the neutrophil function is most likely responsible for these clinical symptoms? Another question, a 24-year-old sexually active woman has experienced the lower abdominal pain for the past day. Her temperature slightly raised. On palpitation, the left lower abdomen is markedly tender. Laboratory findings are given. High WBC counts with the marked segmented neutrophil increase, decrease in the lymphocytes. So laparotomy reveals a distended fluid-filled reddened left fallopian tube that is about to rupture. A left salpingectomy is performed. Which of the following most likely to be seen in the microscopic examination of the excised fallopian tube? You might have seen this also recently. In a 6-month randomized trial of a pharmacological agent, one group of patients receives a COX-2 inhibitor and a control group does not. Both group of adult male had mild congestive heart failure and bilateral symmetrical arthritis of small joints. Laboratory measurement during the trial shows no significant difference between the groups in WBC count, platelet count, hemoglobin and creatinine. The group receiving the drug reports subjective findings different from those control group. Which of the following finding was most likely reported by the group receiving the drug? So, if you see this question is pathology question, but it is integrated with the case control study, PSM case control study. It also comprises of, also interconnected to the pharmacology, the COX-2 inhibitors. So you can see that these type of questions will predominantly asked in your future examination. A 53-year-old woman has experienced abdominal pain for 2 weeks.
It also
She is afebrile, mild upper abdominal tenderness on palpation, bowel sounds are present, and upper gastrointestinal endoscopy is performed. The figure show microscopic examination of a biopsy specimen of a duodenal lesion which is following is most likely present. So you have to identify what is you can see in this microscopic picture. Question number 21. You have seen in your exam also recently, but the case was a post-COVID. Here it is originally this question asked the Staph aureus infection, post-Staph aureus pneumonia, and AIDS and everything is as it was asked in your examination.
Seen in your exam also recently.
A 43-year-old man has had a cough, fever, past 2 months, chest CT scan show finding in the figure A. A transbronchial lung biopsy is performed, yielding a specimen with the microscopic appearance shown in the figure B. Which of the following chemical mediator is most important in pathogenesis of this lesion? Question number 23 is very important for your November examination. An 18-year-old man lacerated his left ear, required sutures. The sutures were removed 1 week later. Wound healing continued, but the site became a disfigured over next 2 months by the process shown in the figure. Which of the following terms best describe the process that occurred in this man? So disfigurement associated, and this is
Continued, but the
interlinked with the forensic medicine also. So
over next 2 months by the process
how it is linked, we will discuss it tomorrow.
Following term best
A 4-year-old child has had high volume diarrhea for the past 2 days. On examination, she is dehydrated. A stool sample examined by serological assay is positive for the rotavirus. She treated with the intravenous fluid and the recovers. Which of the following component is found on the interstitial cells, recognizing double stranded RNA of the virus to signal transcriptions? Factors that upregulated interferon production for the virus elimination. So you have to identify the which is the signal receptor. Patient with extensive endothelial injury from E. coli sepsis have consumption of coagulation factor as well as excessive inflammatory response. Administration of active weighted protein C most likely to decrease the inflammatory response by reducing the amount of which of the following substance. So this is again an integrated question. So as you have seen that most of the questions which I shared with you are integrated, that are integrated with the pharmacology, integrated with the medicine, surgery, forensic medicine, PSM. So this one topic, if you study it properly, then definitely you will get through all type of questions. So what are the questions they ask and how you attempt, we will discuss it tomorrow, and I'll discuss in detail about the theory of these questions. So what I'll do is I'll just post this link of the download in my description box after completion of this video, so you can download those questions that you can save, you can use in future also. And remember, these questions are from the question bank. So this is all from my side, and you can download those questions. We will discuss it tomorrow. And Maxwell, the next postgraduate 23 NEET PG, there will be no next exam, and that will be on 23rd January. This is all from 2023. Dr. Gautam, I'll try to reduce the noise, background noise. I'll consult my IT person in my office,
next exam.
We will reduce
That
the
will be
background noise.
on 23rd.
Thank you very much,
January. This is,
and see you tomorrow
all from 2020
when I'll post the theory sections.